Hi, this is Dr. David W. Kim. Today's video rhinoplasty blog is about revision rhinoplasty and the correction of the pinched, collapsed nasal tip. This can be a very difficult operation because the anatomy is compromised and distorted, but with a thoughtful approach, surgery can result in a restored, attractive, natural-appearing nasal tip. When surgery has resulted in aggressive reduction of the sides of the tip cartilage, a technique called lateral crural strut reconstruction can be used. This graft is placed on the undersurface of the outer limb of each of the tip cartilages in order to restore the normal transition between the narrowness of the tip and the width at the base. An additional graft between the inner limb of each of the tip cartilages is placed to stabilize this entire tripod complex. These images show an intraoperative example. This is a graft, a septal extension graft, which is placed in the center of the inner limb of the tip cartilages to help stabilize them. This is an extended lateral crural strut graft placed underneath the damaged outer limb of each of the tip cartilage to restore the triangularity necessary to create a functioning and a natural appearing tip. This is a patient example of a woman who underwent previous rhinoplasty and had over-reduction of her nose. You can see the collapse of the side walls of her tip cartilage, creating an unusual prominence leading to unsightly shadows and highlights that create an artificial appearance to the nose. You can see by the collapse of the nostrils that her breathing is also compromised. The tip is projected beyond the contour of the nasal bridge, and the contour and position of the columella is very curved and overly upturned. Using the techniques I described earlier, I was able to create a change in her tip appearance into a more natural, rounded, and functional state. The nostrils were reduced, the columella was elevated, and the tip contour was restored to more of a normal triangular shape. The tip position was also able to be aligned to the contour of the bridge, and the columella straightened. This is the opposite view and her 2 3/4 views. Revision tip surgery is one of the more challenging rhinoplasty operations that I perform because the structure is compromised, the tip is collapsed, there's abundant scar tissue creating difficulty in elevating the structure. But with a thoughtful approach, with a structural mindset, and with a meticulous technique, even a very damaged, non-functioning tip can be restored to an aesthetically natural appearing tip that breathes normally. Thank you for listening today.